For the second to the last discussion before we end this live, we'll talk about what's known as a hollow viscous injury. So hollow viscous injury just have to do with any injury to what? Any organ. Is it in the stomach, in the abdomen? I think it's in the abdomen, right? Organs in the abdomen. So is any trauma to the gastrointestinal organ that contains a lumen. So you are talking about the stomach, you are talking about the small intestines, you are talking about the colon, you are talking about the rectum. So those injuries are serious because they can actually lead to leakage of intestinal contents and into the abdominal cavity, right? So they can cause peritonitis, they can cause sepsis, okay, and there's high chances of people dying from them. So injuries to hollow abdominal organs like stomach, bowel, colon, rectum caused by blunt injuries or penetrating injuries. Okay, it could be penetrating injuries or just be blunt where there's no wound. So mechanism is blunt injuries from motor vehicle accidents, falls or direct blows. Penetrating injuries, that's when you're talking about stabs, gunshots. So the damage leads to perforation or contusion. So it now allows the intestinal contents to leak out. These intestinal contents, they are in the stomach quite alright, but they shouldn't go out from where they are actually confined. When they spill out, you have a lot of issues. It can trigger inflammation and infections. Okay, so issues you have is abdominal pain, distension, nausea and vomiting. There's guarding, there's rebound tenderness, okay, peritonitis, there's unexplained shock. Okay, so sometimes they might not bleed heavily at first, so this could actually delay diagnosis too, right? So but if you want to diagnose, you do images like CT scans. Okay, you find free air, free fluid without solid organ injury, bowel wall thickening, mesenteric standing and the rest of them. Okay, then you can also do exploratory laparotomy or exploratory laparoscopy. So surgical intervention is you have to repair the perforation, then resection with anastomosis. That's if a part of the bowel is actually it's actually diseased up. Do you understand? Then diversion stoma in unstable patients or contaminated fields. So that